May I ask some of the people who are on the side to come in front of us, because it's nicer for the discussion if we have some faces and we don't speak to an invisible public. And for the latecomers, it will be easier for them to stay on the margins. Okay, thank you so much. Well, thank you, everybody. I hope, although the time is more a time that would invite us to a small sleep, we can keep you all awake. My name is Sylvie Goulard. I'm a member of the European Parliament. I'm going to co-chair this meeting with Nina. Maybe, Nina, you can say a word, and then I...
Sure. So my name is Nina Rawal. I work in venture capital in the healthcare life science sector in Stockholm, and I'm also part of the European Young Leader Program with Friends of Europe.
Okay. We do have with us Nicola Schmidt, and I must say that it's very difficult to chair the presidency because you are the presidency of the European Union and you have a great experience in European matters. Mr. Kougazian is from the business, is the president CEO of Sanofi Pasteur MSD, and Jim Clarken is the chief executive officer of Oxfam in Ireland. I'm not going to talk long because the chairs are not allowed to talk, but I just would like to make 2 or 3 remarks, and I'm not a specialist of social matters. I'm a member of the Econ Committee of the European Parliament, but I will try to speak here in my capacity of chair of the Intergroup fighting against poverty in the European Parliament. And in the Intergroup, we try to be the voice of the deprived people. And I don't want to provoke, but I'm quite sure yesterday we were together for one of the meetings we organized. Mario Monti talked to people trained by ATD Carmonde, people experiencing poverty, because we always try to put together decision makers and deprived persons. And it's not just to play with the words, but many of them would probably say that Europe could not care less about themselves. I have the feeling that even if there are mechanisms, policies, people who were in charge, like Commissioner Andor, on social matters, etc., a lot of goodwill in Brussels, the feeling, unfortunately, on the ground by many people, above all the ones who are jobless and I would quite say hopeless, it's that Europe is not for them. And we should take this very, very seriously. Not only because the first article of the Charter of Human Rights is fighting again for dignity, it's the dignity of the human beings, but also for the cohesion of our societies and for the welfare of everybody. We have now also the Commission, the last Commission, and I really appreciate that they did put fighting against poverty and exclusion under the 5 priorities of the Commission and the European Union. We have not achieved the goal to reduce poverty by 20 million, but we have even, because of the crisis, more deprived persons than ever. Of course, you know that it is a statistical definition, so it's to be under the level of poverty according to Eurostat. But nevertheless, people fighting in their daily lives are very numerous in Europe. And what we have observed, there is a very interesting study of Bruegel, it's that also we have rather cut expenditures for families and children more than for the oldest categories of the society. So where are we now where we are? The idea is to look at the future and what can we do. In my opinion, we should be aware that since the beginning of the European integration, if you look at the Treaty of Rome, if you look at what Jacques Delors tried to do, there was a very strong social dimension included in the European project. So we don't need to reinvent the wheel. It's something that was at the heart of the European project. It's not competitiveness or social, it is competitiveness through also a better use of human capital. There is a very interesting study of the OECD called Why Less Inequality Benefits All. So my proposal would be for the future that we put the idea of looking at inequalities, trying to understand where they come from, look at who has to do what in terms of education, but also in terms of macroeconomic choices, sometimes at European level, sometimes at national levels. We should put the reduction of inequalities at the center of the European project, not for demagogic reasons. Once again, it's really because it matters. We are aging societies. We cannot afford to waste so many human capital as we do. And it is morally unacceptable, and it is also economically not sustainable. So I stop here. It's easy to say, it's less easy to do, but at least we should really try to fight. And I see here many representatives of NGOs or entities trying to fight against. I see Frike from FANSA. We did a lot on to fight against homelessness. I mean, when you are in the European cities, the beautiful cities of Europe, and you see so many people in the streets, this is the signal that there is something wrong in Europe. Thank you.
All right, we have a broad session here today. That's the social perspective. I'll try to set the scene zooming in on healthcare. Just throw up a few of the dimensions and try to go into the solutions that we want to welcome your debate on. So Sylvie mentioned the demographic shift. As you all know, we're seeing it in Europe and we will continue to see it. Aging people, but unfortunately they will suffer from, amongst other things, lifestyle-related diseases, horrible diseases like diabetes, cancer, Alzheimer's disease, and so on and so forth. So that's going to be a huge challenge. On the other token, we have some fantastic innovation happening in the healthcare space. Completely novel approaches to cancer therapy, digital health that can really, really change the way we organize ourselves and how we interact with the healthcare system. But these innovations, they come at a cost. It's not going to be for free. I'll give you one small example of the hepatitis C drug from the American drug maker Gilead. It's a truly innovative drug. They're actually curing hepatitis C as opposed to symptomatic relief. And these are not the newest figures, but my most recent figure is that it comes at the cost of 30% of the entire drug spend in the American state of Tennessee, one drug. And hepatitis C is not the biggest problem from a healthcare perspective, but very serious. So you understand, we have great opportunity, but it comes at a cost. We are seeing across Europe, the governments are already struggling to finance current levels of healthcare. Last year in Greece, with all the turmoil there, the government withdrew, at least temporarily, reimbursement for basic medications for in-hospital patients. So handling innovation and this really different pricing model will really be a challenge. On top of it all, we have citizens, maybe future patients in Europe, that really take the social contract of Europe for granted. They expect healthcare to be the human right it is, but they're not necessarily voting for the parties that are in favor of European collaboration and harmonization on these topics. So we have a great challenge. It's my obligation as the representative of the younger crowd here today to really emphasize what a great opportunity this could be if we play our hands correctly. Not only because it's part of the fundament of Europe and we need to do this to kind of grant our citizens access to healthcare, but other parts of the world are also going to be struggling with these challenges. Japan, the demographic shift is already happening there. I think because of the one-child policy in China, we should expect to see similar things there. So this could also be an interesting export opportunity for Europe in the future. So what do we need to do? And that's where we need to focus today. I'll just give a flavor. I think we need to really revisit the business models for how we finance healthcare and drugs going forward. We need to be enthusiastic for a new era of public-private partnerships. There's some interesting examples to be learned from the emerging markets. In Europe, we like to think that we're more sophisticated, but the magnitude of change that we should be expecting, I think, are quite similar. For this conversation, I think increased harmonization of EU regulation in this topic, in this sector, we don't see that. The single market is not working when you're introducing a pharmaceutical in Europe, for example. What can we do there to really have that common vision and strategy for healthcare in Europe? So the cynics in the crowd will by now say, you know, what I'm asking for is kind of more or less impossible. But I will answer and say that the alternative with different classes of citizens where in Europe, where it will depend where you live in Europe and who you are, that will actually literally become a question of life and death, that alternative, as it plays out, I think will be even more difficult to swallow. So with that, I really encourage you to really throw in your very constructive solutions on how we tackle this challenge. Thank you. Sorry.
Thank you. So, I mean, this is my first attendance, so I'm going to speak as an industry representative, as you rightly say, but also as a citizen of Europe and as an individual who happens to be actually the grandson of in a family who was being a refugee a couple of decades ago, as my name may indicate. So you will find in my couple of comments some of those different elements melted together. Starting from the discussions we just had, but also we had this morning, I was impressed by the importance of crisis management in Europe these days. Crisis in Greece, crisis with the refugees, crisis in Ukraine, and so on and so forth, economic crisis. And there's one thing I know, at least in my organization, in any organization I've been, is that it's extremely difficult to, on one hand, manage crisis, on the other hand, build the future. It takes a different breed of people, takes a different time horizon. And when it comes to building the future, there are a couple of things which I believe are tangible examples that can lead the way and show the way and make it concrete and give belief and faith in what we are trying to achieve. And there are two elements which could be helpful. The first one is we need common objectives. Not the objective for Europe, that would be ideal, but at least common objectives in terms of what health and inequalities can provide to citizens in Europe. In this respect, starting with clear priorities, and I will give a couple, could be a good starting point. And if you think about it, historically, that's been how Europe has been created. On the other hand, we need also a deep, deep understanding about what is achievable. What it would be the cost, what would be the timing, what it would take. And that's where I also believe that my industrial side of personality is critical, because we need to have industry at the table to have a constructive dialogue about what we can develop together. And I appreciate your comment on public-private partnership. Not surprisingly, I also believe that by having common objectives and a deep understanding about possibilities, we will increase trust. Because trust has been used a number of times, and to build trust in Europe, you need, in my view, to build it on common objective and capabilities so that we deliver on our promise. So what are those, in my view, basic needs that comes when it comes to health and inequalities? There's one I will not elaborate too much, because Jim will do that in a much comprehensive way, which is about poor health and poor economic and social conditions. It would be no surprise to you that, as far as health is concerned, if you are in a dear situation, material situation, economic situation, the health prognosis is impaired. On the other hand, everyone who has been in hospital having a small shirt on his shoulders, or have been sick with fever in his bed or her bed, knows what the sentiment of fragility and vulnerability that you're in. And that's, for me, also a basic element of inequality. Beyond the individual element, there is also an economic and governmental element, societal element, because we all know, as you rightly said before, that we are all spending a huge amount of our resources for treating sickness. At the end of the day, we have more sicker system than a healthcare system. Only 3% of our healthcare investment is directed to prevention. The rest is about cure. And when we know the demographics, when we know the aging population, when we know the pandemic of obesity and diabetes and non-communicable diseases and so forth, the system is just going to be unsustainable if we are not able not only to elaborate, to invest more in prevention, but also to innovate in prevention. There is no other way around. There are also major inequalities within Europe between the countries. If I look on something which I know pretty well, which is immunization coverage, vaccination coverage, you can, if I take flu, which is the most basic example, you get coverage rates in UK and Netherlands of 75%, whereas in France you get 50%. And those are the most fragile people. We're talking about seniors that are exposed to the consequences of flu, and flu is not a small ailment when it comes to fragile people. And we could achieve number of lives saved, more than 10,000 lives saved, if we would have the level of coverage which we are aiming at, and decrease hospitalization by 50%. And unfortunately, unlike in the US, where the chances of coverage is high and is improving, in Europe, things are getting worse and worse every day. Of course, I wouldn't be complete in terms of need if I wouldn't be looking at one of the biggest crises that we all see, which is the refugees. As I said, I'm personally touched with it. And all those people, those individuals, they have huge healthcare needs. And the way we're going to treat them, we're going to take care of them, if only when it comes to prevention, immunization, vaccination, has to be, for them, well thought through. And for the timing, I can come back to it, it's a little bit chaotic, to say the least. But also for our communities, because that's how we will maintain Europe as a healthiest place in the world. So looking forward, you want a couple of ideas about what concretely we can do. And I think there are very simple things, quote unquote, simple things that we could do. The first one, as I said, is direct more investment toward prevention. It's not like it would be nice, it's a must. The investment needs to go where the need is. And eventually it would be to make sure not only that we improve mortality, but we improve the functionality of the people. I'm thinking here, for example, about the seniors. Maintaining seniors at home is more critical than extending life by a couple of days or a couple of months. The other thing where Europe could be extremely critical, as I said, in terms of crisis management, is in terms of coordination. We have the refugees, but all the issues that we are confronted with in healthcare are common. Supply shortages are common. Outbreaks of viruses are common. I mean, viruses don't know frontiers. And today we have mainly a national public health policies that are being put in place. As you have seen, probably, a child died from diphtheria in Spain, another one from measles in Germany. We have thousands, as I said, of seniors that are dying because of insufficient flu coverage. We have many cervical cancers, just to name this example, that could be prevented if we would have the right public health policies across Europe. So I don't believe this is acceptable because we can act on it, and usually the ones that are the more fragile are also the ones that know the less about what are the right immunization policies, and they are the more exposed. So the coordination is one thing, and to deal with the crisis. The other thing is, as I said, a government to improve governance, to improve the way institutions like ECDC or the Health Security Committee operate to coordinate not only the response, but also our strategies, our public health strategies. In this respect, I would like to say that Germany, with its recently passed prevention law, is making a huge step forward and should be seen as an example for the other countries. I'll finish by saying that there is one element also where we could, I believe, Europe could be, in terms of health, at the forefront. It's innovation. It's a big topic. I will not elaborate on this one unless you want to go there. But I believe that's also there are concrete strategies that we could put in place there. Thank you.
Nicolas Schmidt.
So, thank you very much. Well, I think that the commitment on economic and social progress the European project has stood for since the beginning has been seriously shaken, at least with the crisis. And this has nourished the distrust towards the European project. And I think that there is this feeling that Europe doesn't stand anymore for the values of a social model which were at the beginning one of the fundamentals of the European project. And therefore I fear that this perception that Europe is not anymore the caring project, because you have chosen the idea of caring, which I like very much, is a very dangerous perception, because it gives a tremendous field to all the Eurosceptics and all the parties which are populist parties and which use this to say, well, look at this Europe, this is a Europe which does not really respect people and puts markets above people. And I think this is a serious political problem which we really have to work on. just because I see Frank van den Broek, I wanted to congratulate Friends of Europe, and I didn't know that you were here, Frank, but you have drafted this small report on unequal Europe, and I think there is a lot of that inside this report, which should really be taken over. And this social divergence, economic divergence and social divergence, which we see, and I was very impressed by what you said, depending where you live, it's a question of life and death. This is something which is very dangerous, because we are all Europeans, and at least we should have the feeling that there should be not too big differences on the place you are living, or in the social level you are living, because it's not only geographic, it's also a question of social mobility. And here there is this feeling that there is a social, not anymore the social mobility upwards, because many people have this feeling that it mainly goes downwards. So my first point would be a political answer to that. And I appreciate certainly that the Commission has launched this idea of a AAA, a social AAA. But as always, this is a nice formula. But I want to be this idea more specific and more filled with content. And now, after 1 year, you could expect that there should be a period of delivering. And as we discussed a few days ago in another place, there is a real danger. If there is no delivery on this nice formula, well, it will backfire. And here that will backfire also against the European project. Now, my first point is, given all that, we have to readjust, we have to review, we have to readapt the overall governance in the European Union. And the social cannot be any more put aside, saying that it is mainly national competence. Certainly it is national competence, but it has to be fully integrated in the economic and social governance of the EU. And when I say the EU, I mean EU, but I even focus very much more when we are talking about the EMU, which means the Economic and Monetary Union, because it is not conceivable that a monetary union has not also a very strong social chapter. Because if you say that one of the hard policies in the EMU is budgetary discipline, you mean also that this has an impact on social policy. And if the finance ministers are really governing the union, we all know that the social dimension, with all respect for the finance ministers, the social aspect is not taken into account as it should. And therefore, we have innovated. It was not too easy, but we did it by at least convening informally a social Eurogroup. And I think we have really to think about balancing the governance in the union. So, my second point is social and economic you cannot separate. These are the same, these are the two sides of the same reality. And it is very obvious that in those countries where social policy is very active, where social convergence in the society is very positive, well, these are not the countries where economic competitiveness is the lowest. It's even the contrary. We notice that in those countries where there's strong social cohesion, there's also generally a very strong economic innovation, and there is a strong economic competitiveness. Then how can we tackle that? How can we approach it? And here I regret, because I see Laszlo, and I didn't know that Laszlo was here, but I'm very happy that he is here. And I think we have to relaunch the idea of social investment. You have talked about health systems. We really have to put social investment back on the European agenda. And this is not just for the European Union. This means also a new role for national states, but it means also maybe a combination between private and public, because we are open towards the formulas you can find. But social investment, you should not oppose social investment to economic or financial investment. Now, we are talking all the time about the Juncker plan. That's very fine. That's very good. But you cannot just limit yourself to that. You need also taking care of the societies. Because if you do not take care of the societies will break apart. And therefore, I think that investing in people in a broader sense is very important. And therefore, I think we have to rediscuss the social package which was proposed in 2013. And I will try in December, during the last ministerial meeting of Labour Ministers and Social Ministers, to put that back on the agenda to really see how we can do that. A word about, I have 2 minutes, labour markets. Yes, we have to work, not even, on inclusive labour markets, but this is linked to the social package because skills is at the heart. And again, when we discuss about investment in infrastructure, we have to make sure that we also invest in people. And this is even much more important because we are heading for a big technical or technological revolution. And there will be upheavals in the labor markets, in employment, in jobs qualifications. And here we have to be prepared to really accompany these big changes in the quality of jobs, in the nature of jobs, in the skills which are required. Because otherwise, Europe will miss the digital revolution and we will have much more losers of the digital revolution than winners. And this will be a big danger for Europe. This will be also a big danger for our societies. So I stop there.
Thank you so much. And you know, according to the OECD, to give more power to women is also good to fight against inequalities. But nevertheless, I will give the floor to Mr. Clarken from Oxfam.
Thank you. Good afternoon, everyone. I want to talk today about inequality, both at global level and here in Europe. And just to give you some fairly startling numbers, some of which you might be familiar with, so apologies if you've heard them before, but you may have seen a document that we produced in the last couple of years that talk about the 85 wealthiest people in the world that own the same amount of wealth as the poorest 3.5 billion people. And just in the last few weeks, we've reached the tipping point where the wealthiest 1% of the population globally own half of the entire wealth of the planet. And then finally, another number for you, $240 billion. That's the amount of wealth that increased for the wealthiest 100 people in the world in 2012. At that time, it would have been enough to deliver all the rest of the MDGs, just that amount of wealth that was increased for that small group of people. So I think the point to make is that inequality is running out of control globally, and I'll talk to Europe shortly. But and why should we care? Is this a rant, an anti-wealthy people rant, or is it against rich people? It's not at all. It's about the damage that it can cause across a whole range of areas. You know, according to the IMF, according to the World Economic Forum and many others, this level of inequality will stifle growth dramatically for everyone. It results in political capture, so a relatively small group of people have far too much access to the levers of power, and then as a result influence power, and as a result it becomes a cyclical situation where that wealth is retained in a small group of people. And then you know, we've seen dramatic improvements in terms of global poverty in the last 15 years as part of the Millennium Development Goals, which were not perfect, but certainly half of the poorest people in the world lifted themselves out of poverty. All kinds of reasons why that happened, but it did happen. And I suppose the point to make is that it just shows that it's possible. But certainly the indications are that if the level of inequality that's growing at the moment continues, that will stop, and it will actually go backwards. And we have signed this very ambitious, very complex 17 Sustainable Development Goals, which are very exciting, and the most exciting part of all of that is the eradication of global poverty by 2030 and the elimination of hunger. And that is possible, and we have to believe that it is. But in order for it to be successful, there are many things that we need to do in relation to tackling inequality. I suppose just here in Europe, and again it might surprise people that the richest 1% of the population here own a third of the entire wealth. The poorest 40% only own 1% of the wealth. So we're living in a more unequal region than people might have expected. And that, again, is startling for the same reasons. We have nearly a quarter of the entire population are at risk of poverty, and about 7.5 million people are suffering from material deprivation every day. And when the worst of the economic crisis struck and when every government was racing to look for policies, it's interesting that they choose to target the austerity at the poorest, most vulnerable people first. So cutting minimum wages, dropping ODA, development assistance, to support countries outside of Europe, and dramatic cuts in health and education. So, you know, the point that we would make is that this level of inequality is not inevitable. There's the political choices to be made which can make a difference and can change the trajectory of this. And, you know, we talk about solutions, and we would start by talking about a fair tax system. So we need to have progressive taxation both at an individual level and, you know, and to look at rebalancing or shifting the balance between labour and consumption and capital and wealth, because far too much of the taxation currently is reliant on those two things, of which the poorer people will shoulder a greater proportion of that burden. And then let's talk about corporations. We saw announcements yesterday at the Commission in relation to two huge multinationals who have been dodging and avoiding taxes, and with the complicity of some country governments. I won't mention names because they might be a bit too close to home, and as an Irish person I certainly won't mention any names, but I think you know that this is an issue that we're only just starting to lift the lid on. And this was money that was due to governments at the time when they most needed it. And then if you extend that across the globe, we estimate that there's $100 billion of tax lost to developing countries' governments every year due to the manipulation of international tax systems for multinationals to avoid paying their fair share in those countries. Again, that's the tax that's owned by the citizens of that country. It's not owned by anybody else. And it is multiple times the global aid budget. So just let's remember that. So, you know, reforming the tax system at a global level is something that must happen, and certainly we can start here at home. Investing in public services, it sounds obvious, but the people that are most affected when you start cutting public services are the ones that depend on free universal health, free universal education. Others can pay for it. And we need to make sure that there's a specific gender focus, because in times of difficulty, women are most likely to suffer the brunt of cuts to social protection, health and education. And interestingly, to look at national budgets, I mean, we have a situation now where a country like Malawi, albeit a very poor country, has ring-fenced 10% of its entire budget to deliver free universal healthcare access, albeit, as I say, at a very minor level. But the point is the political commitment is there. We need to strengthen institutional democracy. I think a lot of the discussion today has been about the disenchantment with citizens of Europe with Europe. So how do we re-engage with the citizens, particularly the youth, but everybody? How do we really excite them about this project and not be embarrassed? It's not perfect. We've made lots of mistakes, and we need to review, you know, how we can be better. But we do need to excite them about the potential for the project and the potential for Europe's outreach as a leader in the global space. And then finally, I suppose, to look at work. And to look at guaranteeing decent work for everyone that works. Nobody that works should be living in poverty. If you work 40 or more hours a week, you shouldn't be poor. And that is the case for many, many people still. So that is something that we need to really address, as well as how do we give appropriate recognition to unpaid work, which society demands and requires, but it's not rewarded and it's not recognised to the extent that it needs to be. So I suppose, like the refugee crisis, there's a moment for Europe to really look at itself and how is it going to tackle these issues? How is it going to show the leadership that it has shown in the past? And to send that message not just to the rest of the world, but primarily in the initial stages to its own citizens. That actually we care enough, we have the capacity, we have the political courage, the ability, the leadership to do these things. And we will bring the citizens with us. And that can be the tough part, but that's where the political courage is required.
No, I just want to comment on 2 points. The first one is a fair tax policy. We make the battle in the European Parliament. I mean, you cannot have balanced budgets when you don't have revenues anymore, and this was unfair. So I appreciate, and it's not to put the blame on one country. I'm not looking on my left neither. It's not to put the blame on one country. We have made something wrong altogether. We have accepted a system that is unfair, and we have to look at it, looking at the future to change it. And Mr. Bettel made some declarations in this direction in any case. The second thing is that on the refugees, we have to be very careful not to oppose the poor people. We have to not use the opportunity to be a little bit cynical, to put it this way, but at least as we have to face this challenge, we should not oppose the national poors and the others. We have to find right solutions for everybody. And if it could shake a little bit the minds of the people in charge on housing, on healthcare, on fighting against children poverty, the fact that they are more numerous, it would be good for everyone. Because the populists already try in all our country. In France, I'm ashamed with la préférence nationale. We prefer our poor rather than the others. This is unacceptable. It's just what I wanted to say. The floor is yours. Please identify yourself and be brief. Okay. I think you have microphones on the table. Yeah, Frick.
Yes. Me? Thank you. My name is Freek Spinnewijn. I'm the director of FEANSA. It's an organization working on the issue of homelessness. It's the only European organization exclusively working on the issue of homelessness. And I was involved in also writing the little booklet that Mr. Schmidt referred to, although all the honor goes to Frank van den Broeke, of course, but there was a small group of people in the background. Can I say I work 15 years now for this organization, and I have been never as frustrated as now about plenty of things. But let me just mention just a few very quickly. We were talking earlier on about the trust of the EU citizens in the EU process. But we forgot to say that in the Eurobarometer surveys, the general ones, as far as I can remember, at least a decade, if we were asking the population, what do you think should be a priority for the European Union? Poverty has been in the top 3 for at least a decade. So I don't understand why it is not taken up more seriously. The other frustration I have is about the role of the European Parliament. It's not very often discussed, but the way the European Parliament is sidelined when it comes to social inclusion policies is unacceptable. I know that there is no co-decision power, but all the messages, all the efforts of the European Parliament to try to socialize the semester process, for instance, to get poverty into the semester process, have been largely ignored. I don't understand it. If you want a mandate, you could use that. I think we have to also be a little bit more serious about the targets that we set. There was a 2020 target on poverty. We want to reduce the number of people in poverty by 20 million by 2020. The latest numbers are not complete, but the estimation of Eurostat is that we're more than 4% more than when we started. And at the same time, in New York, the same countries, the same EU member states, agree to reduce by 40 million the number of people living in poverty by 2030. If you want NGOs to take these commitments a little bit serious, I mean, let's make sure that there is not this implementation gap. I mean, it's just not enough to set targets. Small other point that frustrates me. There is about 10 European NGOs working specifically on poverty and social exclusion at European level. We're there to partner up with the European Commission to make a difference. What have I seen in the last couple of years is that the money goes down and down and down, and we are told that it will go down further. You might think it's huge amounts of money. It's 10 million euro. 10 million euro, it has gone down to 9 million euro to fund 15 NGOs. Like, what's happening? We have got the priorities wrong. Last point I want to say is on Greece. I was shocked about the self-congratulatory messages of the European Commission on the third program of Greece, because it was underpinned by a social impact assessment. I read the social impact assessment. It was so incomplete. It's not acceptable. I know some NGOs in Greece, they have not been consulted. Anybody has been consulted about that? The issue of homelessness, I don't know if somebody went to Athens recently. You stumble over the homeless people. It has been ignored. It's not even mentioned. There is estimates of 20,000 homeless people in Athens, and it's not in the social impact assessment. And then you see Marianne Thijssen and her colleagues saying, and this will be the start of surely huge social progress. I mean, it makes me very frustrated.
Sorry, I think you're going to have to wrap up.
I'll wrap up, but because I need to come with some proposal. No? We have worked on creating the political ground to advance on the issue of homelessness. There has been a call from all institutions, even the EBSCO at the time, to develop an EU strategy on homelessness within the principle of subsidiarity and everything. And the Commission has not delivered up till this moment, and I think it's unacceptable.
Sorry, can we just ask, I think it's great analysis, but in order to not get stuck in the super pessimistic view, let's try to focus on constructive solutions. Thank you, but thanks for your comments.
I will try. I will try to be a little bit more positive, maybe. But that's interesting that it's an NGO who started.
Could you introduce yourself?
Yes, I'm Frédéric Vallier. I'm the Secretary General of the Council of European Municipalities and Regions. And I would like to speak about the other great forgotten people in addressing EU policies when we work on social issues is the local governments. Local governments are more than often the first level where people go for help. And if we think about the economic and social crisis that we have been following, of course, from our side, if in some states local governments had not been there, the situation would have been much worsened. And if we think about Greece, for example, there are numerous homelesses in Athens, but the mayor of Athens has done an incredible work. And I believe that if he hadn't been there, the social crisis would have been much worse in Greece. So it's some kind of a protection to society. So what I would like to ask maybe, there's a couple of questions. First, the EU implemented the Youth Guarantee last year, or if I remember well. It's not a full success, and that comes a little bit like the colleague was talking about objectives. Sometimes we have very good ideas, but we fail in the implementation or in the evaluation of the system. To see, to really go deep into the proposal. And on the youth guarantee specifically, we had made proposals to involve local governments, and we had proposed a specific program that would involve local governments. We were not heard, unfortunately, but our offer is still available if someone wants to work on that. The second thing is on the SDGs. You mentioned the SDGs in New York, and I was in New York representing local governments. I would like to know how these SDGs, because what we said in New York is that the agenda was global, not only for developing countries. So how is the European Union taking that into account in its own policies? That's a question that would be interesting. And finally, I would like to say that we very much believe in CMR that governance is not anymore something that is from each levels of governments. It needs to be a partnership. It needs to be something that we think together. And if we think about social policies, certainly or health or care for elderly people, if we don't work all together, from the European level to the local level, we will not find the right answers. I'm not saying that we should be empowered on everything, but we should be partners, and we want to be partners of other tiers of governments.
Thank you so much. I suggest, if the panelists agree, that we give the floor to a representative of the municipality of Athens. I know she's with us, and then we might answer the first round of questions.
Okay. So thank you very much for the floor. In fact, after the two previous speakers,
could you introduce yourself?
Yes, my name is Maria Stratigaki. I'm Vice Mayor on Social Solidarity, Welfare and Equality. in the city of Athens. Thank you very much for the good words you said for our mayor. It's true that we do whatever we can, but however, I have to tell you that there is really a surprising emergence of solidarity movement all around Athens. With small groups that they prepare soup kitchen, and I mean all this solidarity movement. And what we try to do in the municipality is to coordinate all this and then increase support, private-public partnership for whatever we are doing, and we are doing very much. Of course, they are not enough. Because numbers are getting up. I just give you a number of yesterday's counting for this European. We counted the people who had income less than 3,000 a year, in order to be eligible for the FEAD, for this European fund for extreme poverty, and we counted about 20,000 people in the city of Athens, in a very small, let's say, part of the central city of Athens. We are not the metropolitan. We are not a metropolitan municipality, so it was 20,000 people with less than 3,000 a year. So just to give a number, and of course homeless is like that. What I would like, let's say, to say is that we do our best. We really try to have sponsorships from private sector. We have a lot of appeal, let's say, on that, and coordinate NGOs and everything. But however, we really need also some support from the European Social Fund. And I come back to what FEANZA, the director of FEANZA, said about the European Social Fund, that can give specific programs on homeless or whatever, like it is the one on the extreme poverty. And I think that I have also to say that not only, I mean, there is no this specific one that FEANZA needs, and we need also, but also for the current European Social Fund, we had so much delay. We are now at the end of the second year of the period, as you know, 2014, 2015, and there are no any calls by the government. So we are really very delayed, and I think that the European Social Fund is absolutely needed in Greece because of the austerity measures and because of the increasing problems. Thank you.
I suggest, if you agree, I give first the floor to the presidency. It's a difficult question. Maya, I was impressed by the words you used. You said, we do whatever we can. There are other fields where the European authorities say we do whatever it takes. Nicola.
Well, I start with the Greek situation, and I think there is obviously the best example how there are economic, financial decisions taken, and there is no idea, and nobody wants to know what kind of impact they take, and they have. And this is, in a way, one could say this is against the treaties. But as it was taken outside the treaties, we cannot even say that, because it was totally taken outside the treaties. And this is against also the values of Europe. Now, I agree, I read this assessment too. Well, I would say at least there was a nice try to give the impression that an assessment was made, but it was made somewhere in an office in Brussels, and I think those who wrote the assessment never have visited Greece and have noticed what is happening in the streets of Athens and other places. So I think this shows that we need a different type of governance in this European Union. And certainly we all agree that there is a need for fiscal consolidation, that there is a debt crisis in Greece, that we have to restore fiscal stability in this country. But this cannot be done just by closing your eyes or our eyes in relation to the social misery which has been provoked, but not only social misery. There's a social misery and there is an economic disaster. And both go together again. Looking at that, we see that the economic side and the social side are interacting very seriously. And this is the biggest problem and the biggest failure of the Greek consolidation or programs, however you call them, or whatever you call them, that's that the economic impact has been as disastrous as the social, and the social has become disastrous because the economic impact has been disastrous. So I think we have to have a different kind of approach when we are doing that. One word on youth guarantee. So again, Lazo is here. He initiated this youth guarantee. I would be a bit more cautious. I think the youth guarantee as such is a very good program. Now, we can say that first, the financial resources which have been devoted to youth guarantee have not been enough. That's first point. Second, that many countries which really are confronted with high youth unemployment, the youth guarantee might be something useful, but at the end it leads into somewhere in a way without a way out. When you take the youth guarantee in Greece, okay, you can try to train young people and so on, but once you have trained them, once you have given them 4 months of youth guarantee, where's the job they can take? So youth guarantee is good in those countries where there are jobs, where there is a gap between skills and the jobs which are on offer. There it works quite fairly. In my country it works quite fairly. In Scandinavia it works, in Austria it works, but certainly in those countries where there are no jobs it doesn't work. And that's why we need, the youth guarantee is part of a broader approach. We should have taken the youth guarantee in the broader approach. And when we say broader approach, we mean you have to have job creation. You have to have a different kind of employment policy. And employment policy is part of an economic policy. So this is again, brings us back again to the same issue. But I would not say the youth guarantee has been a failure. A last word for local. Yes, I think there is, but this is more, not so much on the European level. That's also inside the countries. Europe is not responsible also for the local. There has to be a better coordination between the national levels, the European levels, but then from the national levels to the local levels. And this has not always been done. And this is also a question how our states work, and perhaps that local authorities, local governments have not been involved enough. Though it was always said that local governments have a growing role in employment policy general, but also in housing, not to mention that, and that we have to organize that better.
Thank you so much. I would like to give the floor to Mr. Clarkin on Ireland. Do you believe that the youth guarantee is functioning well from an Irish perspective?
To be perfectly honest, I'm not all that familiar with how it operates, so I don't think I'd comment particularly on that, but just I suppose there's something that kind of strikes me as part of this conversation beyond the Greek situation specifically, is just when we talk about poverty in the EU, it's quite different to the way we think of poverty in a developing country context. This isn't a lack of resources. It's just the way resources are distributed. This huge inequality that we're facing is about political choices at EU level and at country level. And interestingly, on the Sustainable Development Goal commitments, which have now been made by every country in the world, there is one specific goal there on inequality, both internally and externally. So there will be pressure on countries across the spectrum to focus on this as a specific issue. And the theme of the SDGs, which was unlike their predecessors, the Millennium Development Goals, where they talked about reducing poverty, reducing maternal mortality, etc. This is the key theme to this is to leave no one behind. So if Europe starts to think about itself in that regard, that we should not be leaving anyone behind, and that's homeless people on the streets of Athens or in the streets of Dublin or anywhere else, because clearly we have not got that right. We have certainly, in my country, homelessness is at a crisis stage right now. It's worse than it has been certainly in my lifetime. And the policy decisions are not being made to address that, giving it the kind of urgency. And this concept of how do we balance those priorities has not reached that stage yet. And something very dramatic needs to happen, and it needs to happen quickly.
Yeah, just a quick reaction, actually, on the comment you made about it's not a question of means, it's a question of decision and resource allocation. You're right to a big extent. Nonetheless, we have to acknowledge that we have in Europe one of the best healthcare systems we have in the world. There is in the world, I mean, by all means, and that will stay for a certain period of time. So there are different inequalities that are rising from means. My sense, they are also rising from the way we use the means we have, and already the decisions and with systems we have in place to make sure that people that need it have access to the service we are providing. And knowledge in this respect is a critical element because the most fragile, they don't have knowledge about what's available. And that's where you see the big inequalities in terms of protection, in terms of access, and when we're talking about values of Europe, we heard a couple of them mentioned this morning. Access to health is certainly one, it makes a difference. Opportunity to develop oneself and strive and build a family and find stability. And there's one dimension which I think still needs to come in this discussion, which is about, I'm going to say a bad word, growth, economic growth. I mean, the sustainability of what we have is not a given. And as much as sustainability of Europe is not a given, sustainability of our beautiful healthcare system is not a given. And for us to maintain this will require innovation in the way we use our resources, innovation in the ability to develop solutions to meet our needs, and those solutions will by all means require all of us, not only to educate our students, right, to anticipate, to dig deep, and to make the right level of coordination to find those solutions. So if eventually Europe is not becoming, again, a place where we can innovate, grow, socially, economically, in many ways, I believe all of that will be also put into question.
Thank you. A question here. I will take three, once again. The lady here, and Commissioner.
John Richardson from a German Marshall Fund. I have a question and a comment. The question is to Minister Schmidt. Your ministry is the Ministry for Labour, Employment and the Social and Solidarity Economy. I'd be interested if you could explain how the word solidarity came in and what the political process behind that was. Perhaps we all have something to learn from that. Secondly, I've been involved recently in another think tank with the question of whether Europe and the United States have common values. That discussion started with defining three things as basic values: democracy, rule of law, and the market economy. I think that's incorrect, certainly for Europe. The market economy is not a basic value. The basic value is economic justice. And I think we've always pursued that in Europe through our social welfare systems, through the provision of public services in particular. And it seems to me that all the statistics based just on income don't recognize that. And it's one of the great strengths of Europe. And by the way, I think we'd find if we incorporated the value of the public services into the standard of living of people, we would start identifying the European countries which need to improve their systems of provision of public services. I suspect more often Southern European countries than Northern European countries. But finally, then a question, does that mean, for example, that when we look at the homeless, we should be thinking in Europe not just of giving the homeless money, which would correct the income inequality, but the provision of more and better public services for them? Which direction should we go in Europe?
Thank you. You take the microphone on the table, please.
Professor Nuria Chinchilla from IESD Business School in Barcelona. Just elaborating on the two gentlemen here on how to become sustainable in the growth and in a caring Europe. If we don't start by building caring societies, caring families, and then how to recognize this appropriately, this non-paid work of women or men at home. This is something that has been talked about many years, but for sure this is something that has to be on the table again, because otherwise all this to reconcile work, family and life, if we don't take into account the numbers of what does this mean in the GDP of any country, and we are not putting that on the table, it's very difficult to arrive to some sustainability. Otherwise it's no growth and no innovation. We have not the time, neither the time nor the energy. to have the children, to educate them, and to bring this social capital, not only human capital, that we need. Thank you.
Thank you. Commissioner Vassiliou?
Well, I would like to say that sometimes it's a quality of implementation of measures that we adopt. And I will give you two examples. One in the field of health, and the other is in the field of skills gap and youth guarantee. In the youth guarantee, one of the options is to give training to young people in order to enable them to fill the skills gap. But the quality of apprenticeships and traineeships is very important. It doesn't suffice to put a young man in a firm or in an industry where nobody cares about him or her. They leave the traineeship without getting really the experience that we want them to take. The second is on health. In 2010, we adopted the cross-border healthcare, which came into force in 2013, which means that if a citizen suffers from a very rare disease or a serious health and they cannot cope at home, then he can go abroad and receive the healthcare. The first report on this came out this year. And believe it or not, 10 countries out of the 28 have not sent anybody. They have not allowed anybody to go abroad. And not only that, they have not given to the citizens any information about their entitlement. So to adopt measures without really quality implementation does not get us anywhere.
Thank you. Sometimes I dream about a system of points for member states. They have a certain amount of points. When they don't implement, they lose points, and at the end, they have no voice anymore in the European Council. Now, it will be something very efficient. We should try to think in terms of making it efficient. Last question for this round, Mr. Van den Broek, and then we will make another one. Please be all short.
Yes, I have a question which follows up on maybe the last intervention on healthcare, but just one sentence before I ask that question. The reaction upon my neighbor's intervention was that we should not be too pessimistic. But I think what Freek has been saying, and other people also, I think also the minister, that if the new commission does not deliver on expectations that have been created, that will backfire as a boomerang in everybody's face. And so they must become operational. Now, in that sense, the example of homelessness is an interesting example because it's a truly European issue in part. It's about failed mobility. So it has a very European dimension. And moreover, if the Commission would wish so, there are some quick wins here at the European level. We documented that in our report. I have the same kind of question with regard to healthcare. Suppose, and this is a question for David Kukazian, suppose you would have the possibility to formulate your top priority proposal on an initiative that only the EU can take at the EU level. Because it is one thing to say member states should so and so. Okay, it's another thing to say, why do we need the EU here? So what do you think would be your top priority for a kind of an initiative that only the EU could take and not member states can take? And maybe that can be a quick win added to quick wins like you can achieve in homelessness.
I'll answer directly this question if you agree. And it's going to be pretty simple. And it, to some extent, comes back to the point you made about execution. We are Europe. We have health policies which are totally different from one country to the other. And people are traveling. Viruses are traveling. I remember Prime Minister from Luxembourg yesterday saying that he had to wash his cars to make sure that it didn't bring microbes. So it looks like, to some extent, we have come to the end of a system where this is left to the member states only. So in the US, you have the CDC, the Center for Disease Control, which is extremely powerful in driving public health strategies. In Europe, ECDC is not at that level. Not because they don't want to, because they issue guidelines, they're simply not followed by the member states. To give you a very concrete example, there are a couple of countries that are implementing virus-controlled strategies just to eradicate the virus from their countries, which makes absolute sense. It's like the prisoner's game. If one doesn't play ball, everything falls apart. And that's the case, because some countries don't play ball. They don't believe in it, they have different strategies, and in the end, Europe loses. Because it's a waste of energy, it's a waste of cash investment, it doesn't take much more. So if there is one thing which I would strongly advocate for a better use of resources, for better health, better outcomes, less inequalities between citizens of Europe, is that we can put around the table through the Health Security Council, through the ECDC, and align those national health policies. It's that simple.
And if I may just add to that, from the venture capitalist and innovation perspective, I think that's the advantage to the citizens, but back to the competitiveness and growth perspective, Europe really needs to take a serious thought around the single market in this sector, whether it's cross-border health, but also how you introduce innovative products to the markets in Europe. As when you're introducing a new product today, it's not uncommon to say, let's just pause Europe, because it's so complicated. Every country has their own regulation. Let's go somewhere else. So I'd say that the EU can really harmonize. And just to clarify on the comment, I didn't mean pessimistic in terms of, just wanted to have a more, after this morning's quite gloomy conversation, I'd say looking for a more constructive debate.
Okay, maybe, Nicolas, you answer one question, and then we take the last ones and we try to conclude. Thank you.
Yeah, just to explain why my title is Social Economy and Solidarity Economy. I believe very strongly that we need to develop a social economy, which means that we should combine the possibility of enterprise, functioning like an enterprise, and social aims and social objectives. This is possible, this exists. And when we are talking how can we tackle the big social problems, the new needs in the social area, but also in healthcare and so on, how can we tackle this without using, as you said, the market as the only value? And I think that the market economy is not a value. The market economy is an organization to achieve what we believe, if it functions properly, the best result, the best allocation in terms of production factors, and so the best results in terms of growth. And social economy combines some elements of a market economy, but social objectives. And therefore, we really want to promote social enterprises. We have a big numbers of people who are not anymore integrated in the normal labor market. What are we doing with them? What are the perspectives for them? We have a lot of demands in the social area which are not taken into account by the so-called market economy, but they are there. We have really to respond to them. You are talking about family and professional life, women and so on. Childcare is for me an essential aspect. Also in a social perspective and gender equality, because I didn't mention it at the beginning, in the perspective of gender equality. And therefore we have really to promote this new economy inside our economic system. And here also some ideas have been launched a few years ago. Unfortunately, this has been stopped. And we try as a presidency now to relaunch it. We will have in December a big conference that Europe should really relaunch the idea of the social enterprise and boost the social enterprise and favor the social and solidarity economy.
Thank you.
Yeah, just one word. We call it sometimes social economy and sometimes solidarity economy. It's both things going together, because the objective is to increase solidarity in our societies, to have an inclusive policy and not a policy which excludes. And that's why solidarity is written there.
Two last questions, Anna Diamantopoulou, and then on my left. I'm very sorry for all the people who will not have the time. Madame Diamantopoulou.
Thank you. I would like to make a comment on the issue of poverty in countries of crisis and to underline the need to see it in a different way. The basic difference with poverty as we analyze, and we have worked on it for years, and poverty in countries of crisis is that in these countries we have a transformation of a huge number of people who belonged to the middle class in 2 or 3 years in low-paid workers and then in non-paid workers. But please don't have the idea that coming to Greece you see cities with homeless and hungry people who are desperate, etc. No. They are dignity people. They are desperate because there is no growth perspective, but they have the skills, they have the means, they have the experience. They can change their lives in 1 year. So it's a big difference the way we speak about these people and the other category of poor people. And in this second category, I have committed myself never to speak in Greece instead of having concrete ideas and not just to describe the Greek drama. So if we want to change things in these cases, what we need from Europe, because all other things are to our politicians and to our decisions, is first to proceed with the European banking system, so to see the banking system to be again strong in Greece and protected. And secondly, to see this investment package, the Juncker package, to be implemented. It's 1 year that we speak about this package and nothing happens. So investment, working of banks, and a very active role of the investment bank to see all these people in 1 year time to come back and give life to economy. Second point in one line. As far as the educational systems are concerned and the role of the educational system with the poverty, in the last 5 years, it is more than 13 European countries where the educational budget has decreased from 10% to, be careful, 65%. So it means that in 10 years, the gaps, the inequality gaps in Europe, because of the changes in the educational system and less investment in many countries, will be even bigger. So a concrete issue is how we face the educational budgets, comparing with the Stability Pact at the European level.
Thank you. Okay, do we have time for 2? I mean, you are very liberal. So if you are very short, we take 2. Yeah. If you are too long, it's your fault. It's not my fault.
I got it short. Does it work? Yeah. My name is Willem Blanket. I worked many years in the European Commission, among others on the preparation of the euro. And I'm writing a book at the moment, The Euro Explained to My Grandchildren.
That's 1 out of 2 minutes.
No, I don't think so. I'm at 30 now. The word was said, no growth perspective. I sit again in a meeting where we talk about a disease and the word of the disease cannot be mentioned. When I grew up, the word cancer could not be mentioned, and now it was sometimes called C, and now we can talk about it. In this room, I haven't heard the A word yet, austerity. The 3% deficit has been invented by bookkeepers who don't understand how an economy works. The UK, the US, and China managed to grow themselves out of the deficit and to reduce the debts. Europe remains stuck. We celebrate 1.3 or 1.9% growth in Spain after 6 years of decline by 8%. The problem is this emphasis on austerity. Let's call it by its name. Thank you.
David Garrahy from the European Youth Forum. I'm going to give you 5 quick bullet points so it makes it quicker. We're delighted to see such discussion on the Youth Guarantee. We've analysed it based on its impact on young people. Here are 5 recommendations. First of all, and it's not easy, as Minister Schmidt said, we need a better economic environment. When there's 20% youth unemployment, the Youth Guarantee will not have an impact. And how can we have cuts in education? when we're implementing a youth guarantee at the same time. There needs to be quality jobs for young people when they through the youth guarantee, or else it won't be beneficial to them when they graduate. Youth organisations, cities, other partners need to be right involved in the middle of this. They have vital roles to play. Public employment services need to give personalised services to young people, and we were delighted to see that in the long-term unemployment recommendation proposal, but hope that young people will be more integrated in that. And lastly, there needs to be proper monitoring and evaluation of how the member states are implementing this. The SDGs have indicators on youth unemployment. If we want to really implement that well, we have to really look at it in a very comprehensive way, and I think the SDGs are the opportunity. Thank you.
I suggest that we go this way. So, Jim Clarkin, you begin. You can answer or make your final comment as you prefer.
I think I'll go for a final comment. Look, I think it's an important moment. I think we've been through such a difficult time over a large number of years. I think people have become despondent. We need to refocus the populations of Europe around these issues. We need to re-engage them. We need to think about, somebody talked about growth earlier. I mean, you know, growth will be stifled if inequality persists to the level that it does. So, I mean, these are policy issues in self-interest or in the interest of the population, whatever way you want to look at it. These issues need to be addressed, or we won't get anywhere. Just one group that I hadn't really mentioned earlier on was the private sector and the role of the private sector in this. And we, you know, at the Sustainable Development Goals, the private sector are very visible. They're going to be an important actor. We welcome that. We welcome, you know, if the private sector behave appropriately, they will lift more people out of poverty than anyone in creating quality jobs and building infrastructure and doing other things that are important and innovation for growth. But it will be critical, the way they behave, the way they're held to account, and the way, particularly as I referenced earlier, the way we build taxation systems across the globe that ensure that companies behave in a way that's appropriate, that are taxed appropriately in the countries and where they generate economic growth or economic activity, and that there is nowhere left to hide in terms of shifting profits and moving away from fair taxation, which ultimately will be a key driver to the kind of sustainable growth that we're all hoping for.
Thanks, Jim. Obviously, I totally adhere to the citizenship from a tax standpoint, and that's eventually going to be even more critical when we move into more digitalization, because the value will be attached to the data and not necessarily to some of the goods. I'll probably conclude by saying we have wonderful assets in Europe. We have dear needs, many challenges, many crises, and so, being a representative of the private sector, I would say what I'm looking for is more Europe, for sure. I mean, that goes with, it should go without saying, but I'd rather say it. And the comment from Mr. Davignon this morning saying there is a risk on Europe should not be underestimated. I mean, there is a risk, and the risk on Europe, like the risk on the Brexit, is certainly a risk for growth, it's a risk for stability, it's a risk for people. And the question then is, what kind of more Europe do we want for? I heard a lot about many comments about we need a strategy, we need an industrial strategy, we need a. I'm always wary when we discuss about global strategy, because things move so quickly that the time you have developed and explained your strategy, it's already obsolete. I personally believe that we need a roadmap. I personally believe that we need good projects. We need good quality projects that stand on their feet, that will deliver, that will show the way. They will be visible, they will create beliefs, and then people can relate the impact of those projects to their lives. And that's how I believe we will rejuvenate Europe, as it was kind of conceived even at the beginning. So basically, we will need to have those good projects to have a convening party, and Europe can do that, convene the stakeholders, the taxpayers, but also the associations, the NGOs, and the private sector, because without those, there won't be any good projects.
Yeah, I echo that. I'll stop where we started and say that, you know, good healthcare and equality is really part of the fundament of this, the European project, and if we want to continue guaranteeing that to our citizens, which is in essence a human right, then huge steps need to be taken, but we've done bigger things before, and if we want to do it, we can do it, so we just need to get to doing it.
I would just say that I really thank Friends of Europe for choosing this issue, because it is not so often discussed. You did a very good job with the booklet. Fortunately, Nicola remembered us that it exists, and I hope we can go further. In the European Parliament, we try to do our best. And I have things to mention. So I give the floor to Nicola, and I will come back after I read the paper.
Okay, thank you. I think that we had a decade or two where welfare states were considered as a handicap in globalization, were considered as a big burden. There's this incredible comparison. Europe, that means 7% of population, 20% of GDP, world GDP, and 50% of social expenditures. First, it's wrong, but by the way, it's nearly stupid. Because I think our welfare states are a tremendous asset. And I think if you talk about healthcare, if you talk about education, if you talk about equality also, these are assets we should really use to become a modern, competitive, inclusive economy and inclusive society. And I think this is a big project we have to work on in Europe. And I agree, we need perhaps to adapt also our growth model, which will anyway change with all the technologies which are changing. But we should do it in a way where we will not produce more and more losers, but we should try to have most of our citizens winners of that.
The very last word, there is not only one report of Friends of Europe, but two reports. One is on unequal Europe, the recommendations for a more caring EU, and one is on adapting health policy to a changing Europe. So you have a lot to read. Thank you, all of you, and let's enjoy a coffee.